Hello, I'm Michelle Lavander, Director of the USC Center for Health Journalism. Thanks for joining us today and welcome to our Health Matters webinar covering coronavirus, how a pro reports on vaccines. The nation's vaccine rollout is not going as planned. As we survey our progress in mid January, the country has reached just about half of its original year end target of 20 million vaccinations. Georgia has fared the worst, putting only 20% of its vaccines into people's arms as of yesterday. And West Virginia has done the best, using up 69% of its doses, according to federal data compiled by the New York Times. Meanwhile, close to 30 million doses have been delivered to states, territories, and federal agencies. But if things seem chaotic now, they can easily get worse in the weeks to come. With lives on the line during an unprecedented COVID surge, consumers desperately want to know when they can expect their vaccines, and policymakers need to understand what is standing in the way of a faster deployment and if vaccine priorities are being honored. Tracking distribution and conveying the complexity of this story to your audiences is not easy. Our distinguished speaker today is here to help. We've asked Lisa Krieger, a veteran science and medicine reporter for the San Jose Mercury News and the Bay Area News Group, to help break down the steps you need to report on this story in your community. We want to thank the Commonwealth Fund and the National Institute for Healthcare Management Foundation for supporting this program. We also want to express our appreciation for donations to support this work from individual participants like you. You can tweet about this webinar at the hashtag COVID vaccine. A word about our format today. We'll be hearing from Lisa first, and then we'll turn it over to our audience for questions. Because we have many people participating in this webinar, we'll ask you to write your questions in the Q&A panel of Zoom. You can also write us there with any technical concerns. We'll be archiving this webinar later today at centerforhealthjournalism.org. And now let's turn to our speaker, Lisa Krieger.
Thank you, Michelle. Put my PowerPoint up. There we go. Thank you so much. And boy, what a privilege it is to be a journalist right now and explaining this to our readers that are just desperate for information. Proceed. Okay, so this is the question, right? How do we get back to this? It seems like it was so long ago. I think that was hardly strictly bluegrass in San Francisco. We miss it, and vaccines are what's going to get us there. I don't need to explain this to you. Things aren't looking good. This is why vaccines are absolutely critical. The better we are at this rollout, the faster we'll get there. And there's so much great journalism now. Oh my gosh, and just so many opportunities. This really is our moment in a lot of ways. Readers are so frustrated because they're not getting the information they need from cities and counties and states and from the federal government. They're turning to us. And I've got to tell you, I've never had the kind of relationship I've had with readers that I'm having right now. And you know, what a privilege it is, and for us to really step into that. Some of the stories that many different ways of approaching journalism now, and these are some of the different types of stories I've been doing and that you can do too. Really quick Q&As off the day's news. The traffic for those has been tremendous. They're lovely because you don't have to write beautiful narrative journalism. You can just pull the facts out, Q&A format. A consumer guide, when, how, where to get vaccines. What do we know about safety? Analysis. That's really resonated with a lot of readers too, because they really want some explanations for how did we get here? What are the problems? What's going on? And because we do have access to the people who are making these decisions, we can really help explain this to readers. And then of course, investigative pieces of what's going wrong and why. And then, you know, my personal favorite of what's in the pipeline, how are these next gen vaccines going to work? But really the stories of the moment, I think, I'm finding myself to over the past week and then the upcoming weeks, really are these Q&As, the consumer guide, and then the analysis, because people are so desperate for information. All right, so these are the 4 stories we're going to review today, and how to go about reporting them, and what we know about each of these subjects. And my goal is just provide you with resources and also tell you what I know at this point about each one of these things. And because it's gotten really complicated really quickly, and it's super hard to keep up, especially if, God forbid, you're trying to do other things besides cover our vaccine coverage. So what we'll be talking about is why distribution is taking so long, what keeps changing, what's going on, how, when and will I get it, and how, and is this fair and equitable? Is the distribution fair and equitable? And then how will this fix my life? And certainly how will it get our economy back on its feet? And there are many more stories. Feel free to add them in the chat so other people can see what you're doing. And then we'll take your questions. Just very briefly, the survival strategy. This is my morning routine. I'm sure you all have your own morning routines that are equally effective, if not more, but I'll just share this with you. I check email, obviously. Government communications, we've got emails from the feds, the state, the county, and the cities. So obviously you want to be on all those email lists. Universities have saved me repeatedly. They have these emails with all their updates, have press briefings, grand rounds, which I highly recommend. But here we have UCSF and Stanford, stellar grand rounds, Harvard, Johns Hopkins, and others. Grand rounds, in the old days used to be when like the head of the department or the chair of the department would tell other members of the hospital community what's going on. These are public now, and it's really, particularly UCSF, highly commended. You're hearing at the same time that everyone else is about what's new and what's moving. And then webinars that they've graciously been hosting. Twitter is essential. That's really how scientists are communicating these days. At the end of my talk, I have a whole list of who I like to follow on Twitter. Used to hate Twitter, it's this fire hose of information. Right now, it's really where I find out what the leaders are thinking and what they're telling each other. Obviously, New York Times rocks. They've got a coronavirus newsletter. For Stat News, if you're not going to subscribe, I do it like pronto. It's really, they've got just amazing journalists doing coverage that's really very focused and deeper in the weeds than a lot of us need to do, thankfully. That being said, they tell you everything you need to know. Science, of course, on their newsletter and email distribution list. And then there's some new podcasts that I really enjoy. If you're going out for a run or drinking a glass of wine at night, Andy Slavitt has one called In the Bubble that's great. He's got the new CDC director. He just interviewed her. This Week in Virology gets super wonky, but it's also charming and brings you up to date every week on what's going on. All right, first, I'm going to do a real quick primer here, and forgive me for those of you who already know all this stuff. Vaccines, of course, Pfizer, Moderna, we know all about that. So what's next in the pipeline? We've got Johnson & Johnson and AstraZeneca. So as you all probably know, AstraZeneca's vaccine will be available to the EU probably in mid-February, which is pretty amazing. Not quite sure where they are here in the US yet. We're going to get some data in February. The FDA will be reviewing it and we'll have a lot better sense then. Johnson & Johnson is the one that everyone's really watching. So why is that? It's because unlike Pfizer and Moderna, you don't have these crazy frozen supply and storage issues. So a whole lot easier to get out, particularly to rural areas. The other huge benefit is that it's one shot, not two, just one. So you can just imagine how much easier the tracking and paperwork is for that. Real game changer when it arrives. And then yesterday, this was cool. Johnson & Johnson had data that was published in the New England Journal of Medicine, and it really gave us a hint as to how this single shot will perform compared with a double shot. So they basically looked at when the neutralizing antibodies, the protective antibodies were highest. Day 29 after the first vaccine dose, it seemed to be pretty protective, but needs to be watched further. So anyway, this vaccine is really critical for amping up our supply and speeding up our efforts to end the pandemic. The bad news is there seem to have been some manufacturing delays with Johnson & Johnson, production delays. Politico had a really nice piece a day or two ago about that. The New York Times has also. The company had originally pledged to deliver 12 million doses by the end of February, and with plans to roll out 100 million doses over a month or two after that, next couple months. The Operation Warp Speed co-director said on Monday that there has been a slowdown, so we're on track now for just single-digit million doses by the second half of February, but a lot more by April, he's saying. So stay tuned. To learn a lot about what's happening, really recommend the Operation Warp Speed press briefings. They come out of HHS. This is the email address for HHS. And then if you try and reach the CDC, you try and reach the FDA, they will typically send you back to HHS. So HHS is really where a lot of this information is coming. All right, another quick primer here. So once we've got the vaccines, then what happens? And forgive me, those of you who already know this, the federal government decides allocation, how much each state gets based on their supplies, based on the percent of the US population. And then with this most recent announcement, which we can review, they're also looking at what percent of 65-year-olds you have in the state. And they're also looking at how well your vaccine effort rollout has been so far. And they're saying that they're going to link their distribution to these metrics. The federal government also recommends, not mandates, it recommends eligibility and priority groups. We'll revisit that in a second. And then the federal government also has its own pipeline for deliveries for the long-term care facilities. That's via Walgreens and CVS. It has its own pipeline to the VA hospitals, its own pipeline to the federal prisons, and then a few others. The states can actually decide who's in these priority groups. That's a state decision. And then counties do have some flexibility. Who's eligible to give the vaccines? What's the timeline? How does it get there? Once again, the counties do have flexibility, but they, at least in California, they really need to wait on the state to authorize when they're going to jump this next phase. Any questions, we can address this further, but I just wanted to go over that. So we're going to go through the stories that I mentioned at the outset. One story, of course, is why distribution of the vaccine is so complicated and so much slower than expected. I'm going to fix my screen here. Put this slide together last night. The numbers have been updated, of course, this morning. When I did this PowerPoint, there were 27 million doses being delivered from the feds. That's now up to about 29.3 million. What's actually being administered, shots in the arms, 9.3 million yesterday. It's now up to 10.2. We don't have to worry about specifics, but boy, look at the difference. Look at the difference. And that's why people are getting really upset. So what's taking so long? Why is distribution of the vaccine taking longer than expected? This is where you can, this is a story that just lands right on your feet and where you can really help. And how you tell that story is looking at the state data and looking at your county data. So as evidenced by the previous slide, this whole chain of responsibility is going from the feds to the states to the locals. And feds are basically saying, you know, we've helped create these vaccines, we funded it, we've shipped it, and now it's on you. It's on you to distribute it. So where do you go for that data? So there are a bunch of many sources, but the big ones we'll review now. One is the CDC COVID data tracker. The other is Bloomberg vaccine tracker. So I don't know if anyone's on this from Bloomberg. They've just rocked it. Great site. And then, of course, your own state's database of county data. So the CDC COVID data tracker, forgive me for the way it looks, I just did a snippet from their website, and these numbers, of course, are a little bit out of date. If you go to this website, this is what you'll see. You'll see the number of doses distributed, and you'll see the number of doses administered. These are things you can just plunk in your story when you need to update it, and you'll have accurate data. The site also has numbers for the long-term care program and distribution and administration. So super important. This same site also has a really lovely map, which is total number of people nationally by state who've gotten first doses that have been reported to the CDC. This map's a little bit out of date. What you'll see when you go to it is if you hover over your state, numbers will pop right up. And it'll also tell you the number of shots per 100,000 residents. So how great is that, right? Really, really good. And we can talk about this later. The beauty of this information is you can compare how you're doing to other states. This Bloomberg vaccine tracker, again, this is out of date, very similar in platform. You hover over the state, it has fabulous numbers. They're also updating it daily, which is amazing, really beautiful. Bloomberg's also doing a global graphics map where you can hover over the US and different parts of the world. You can see how we're doing. Pretty sobering picture. You can see who's getting vaccines and who's not getting vaccines. Obviously, this isn't over till we get everybody. And then this is where you can really provide a reader service to your local readers, because this is local, local, local. If you've seen one county's vaccine rollout plan, you've really only seen one county's vaccine rollout plan because it varies greatly. So what we've done, we have a lovely smart data reporter who gets this for us and has put it in this beautiful chart. And this is where we're ranking Bay Area counties of what's been allocated. You can do the identical thing. And some counties are doing their own beautiful charts. And I just love, this is Hennepin County out of Minnesota. I pulled this up last night. I'll warn you, this is like changing daily. So there are counties that didn't have websites last night that are having them today. There's some that won't have them today, they'll have them tomorrow. Look at what this county's doing. It's extraordinary. And way better, frankly, than what a lot of California counties are doing. Even in Silicon Valley, don't have anything quite like this. Really helpful. And you know this, but a lot of readers don't. They're not publicizing this stuff, right? So because you know it lives there and you know where to find it, you're really helping your readers by directing them to this or replicating it and featuring it in your coverage. Final thing on this subject, this is a terrible image. I just got a snippet. The COVID tracking project out of the Atlantic, their dashboard is amazing. And there are listing states that are reporting vaccine-related metrics. And then if you were to go to this site, just Google COVID tracking project Atlantic. Actually, way off to the right, which you can't see, they have URLs for the different states as to where to go for data. Really terrific information. So what's the holdup, right? Like what's accounting for all of this? I put this together quickly and it's not very pretty, but the central problem is, frankly, we've decentralized to a fault. President-elect Biden is going to be speaking at 4:15 today, Pacific Standard Time, and there'll be news, I'm sure. My guess is there's going to be an effort to centralize things a little bit more, get the whole nation a little bit more unified and on a similar track. But what's basically happened is that responsibility for these vaccine rollouts has percolated down to the local officials who are the most busy and the least well-funded. So these are the folks that are testing, they've got overcrowded ICUs, just really, really overwhelmed. And now they're being asked to do this vaccine rollout in addition to everything else. You might be saddled with demanding protocols, a really rigid tier system and paperwork. Vaccine deliveries are often really sporadic. They're not on a regular schedule. They're often not finalized to the last minute. And it is really, really hard for local health officials to plan, like where are you going to administer these doses? And then on top of that, we've got software glitches, overwhelmed phone networks, unstable websites. The whole IT component of this is been a challenge. And guarantee you, as we're speaking right now, they're trying to build out these platforms. All right, and then everything keeps changing, right? So we've got all that, and then and meanwhile, feds are changing things, and then states are changing things, and counties are changing things. So the readers, what they really want to know about is what's going on, where am I in line, what's all this mean for me? All right, so over this quickly, the original federal recommendations, and again, these are recommendations, they're not mandates. The CDC had this really lovely, very complicated tier system. So we had our phase 1, which is healthcare personnel, folks in the long-term care facilities. We had phase 1B, and this was going to be the frontline essential workers and people over age 75. We were going to have phase 1C. Those are folks 65 to 74, and then people who are younger but had high-risk medical conditions, and then other essential workers that weren't included in phase 1B. Then we had phase 2, which is people 16 older, anybody not in phase 1. And then, I'm sorry, just while we're on phase 1, so this was pretty straightforward. Everybody was in pretty much agreement. It was pretty straightforward and simple. States and counties can do their own thing. What we found, and then Kaiser Family Foundation did a beautiful report on this, we'll reference it later. Most of the states, 45 of them, really followed the CDC guidelines pretty tightly and prioritizing healthcare workers and long-term care residents. 3 of the states threw in some law enforcement folks, Nevada, New Hampshire, Wyoming. 2 states, 2 places, DC and Utah, went ahead and put their long-term care folks in phase 1B, not 1A. Just to complicate things a little bit further, while we're still talking about phase 1A, which frankly is where we're still at in California, it created its own tiers within phase 1B. So, 1A. So what are those tiers? So California, we've got all these acute care hospital staff. I'll let you read it. That's who was in tier 1. Once they finished them, they moved on to tier 2. You can see they kind of broaden the net, right, of anybody who's sort of a front-facing healthcare worker. And then tier 3, which was everybody else, all these folks out in the, your dermatology clinics, your lab workers, your dentists, pharmacy staff. All right, so what's changed? Originally, the CDC had phase 1B, were going to be these adults over age 75 and older, and then these frontline workers. What they were really trying to do was to straddle both who's at risk and who's dying and who's filling up our ICUs, while also trying to get the economy back on track. And California really reflected that. They're really trying to hit both in parallel. That was the goal. So phase 1B had these older folks, and then phase 1C, you kind of work your way down. Then states started to break rank and started doing their own thing, which was entirely their prerogative. And they started moving up these residents that were 65 and older into, it doesn't even have a phase, it hasn't been called a phase. Again, I guess it would be phase 1B. Who the hell knows at this point? But Alaska, Florida, Texas, notably, because there are a lot of elders in their state, and undoubtedly there's a huge amount of pressure. They said they just move them on up, and they start vaccinating them. And then that created pressure on other states to do the same thing. So Alaska, Delaware, others. Louisiana, Montana are starting now to give it to folks over age 70, West Virginia over age 80. Again, where do you go for all this information? You go to your state and county health department. And if it's not on their website, call them up and bug them, because they do have this information and they do need to share it with you. The AARP has actually been very useful, I find. They've got a website which they keep pretty current, and that is, you'll see it at the bottom, the URL is there. It's called The Vaccine in Your State. So it's a good place to go. So why, what was happening? So super high level of frustration with the slow rollout. I think a lot of states felt like this CDC criteria was just too restrictive. A lot of people think the supplies will be adequate over the next month or two. So we're really, by being super restrictive, we're really unnecessarily bottlenecking supplies. And then fear of missing out. I think certainly a lot of our elders in California, we're seeing people in Florida getting vaccines, and they're saying, what the hell, why not me? And what are we doing wrong? So that creates pressure on the states. What else? There are a million other reasons. I really encourage you to talk to your state people, your hospital people, about that. Before we move on, Kaiser Family Foundation had a beautiful report that was updated on January 11th. That was an update on the state prioritization plans, and this really addressed how the states were beginning to break out and do very different things. I did a story that has gotten a whole lot of traffic and was really popular, where I compared California's rollout with West Virginia, which is currently ranked #1 in the nation for the percent of vaccines they've gotten that are actually in people's arms. West Virginia is a state that's not rich, not high tech, got a opiate problem, as you all know. It's got a terrible, particularly in the winter, landscape. It's very icy. It's got a lot of mountains. They've just rocked it in getting vaccines in people's arms. And it was really wonderful, I have to tell you, to call West Virginia and get them to tell me about what they're doing right. What are they doing right? They're super proud, and they deserve to be. In a nutshell, they've kept it really simple. They actually opted out of it, the federal CVS Walgreens plan. They have their own pharmacies. They have like 50, 60, 70 independent pharmacies, mom and pop pharmacies, that already have their own existing relationships with these long-term care facilities. So they got the National Guard in, and National Guard, the Kaiser and Moderna sent the supplies to 5 different hubs around the state, including like Lewisburg, which has 2,000 residents. From those hubs, the National Guard distributed it out to these independent pharmacies, and the pharmacies were good to go. Like in hours, they were able to get the vaccines to the long-term care facilities. And I think their plan is to deploy something really similar as they continue this rollout. Wonderful story. And then South Dakota, which is, I think, ranked #2 now, has its own really interesting story that we'll tell you about. And then you compare that with California, super high tech, 5th, 6th largest economy in the world, but a very fragmented, fractured state, and its own geographic problems. But anyway, it's really so many great stories to tell about what's going on. All right, so what's going on now? Just a year or two ago, the federal government recommended adding people over 65. So most or all the states are revamping. As I mentioned, President-elect Biden will be speaking today. He may elaborate on that. So basically, 65-year-olds have jumped ahead, right? So they're basically essentially in the same tier, or right after healthcare workers and long-term care people, residents. The teachers and the workers in childcare, and then some of these food and ag workers that had been, and essential workers that had been with them, they were not elevated, but the folks over 65 were. So the states are revamping. They've got their work cut out for them. So is this a good thing? Well, certainly, if you want to keep your ICU inventory low and keep people alive, super good strategy. If you want to get teachers back in the classroom, one could argue maybe not so good. If I were, a migrant worker or someone in food production, it's like, what are we, chopped liver, right? But Anyway, this is all being restructured. And it also creates new challenges, right? And I love this quote from Kat DeBerg, Health Officers Association, California. Expanding the list of who's eligible for the vaccine does not get us more doses, does not get us more vaccinators, or any of the other resources that we need to effectively run our operations. So it's not enough to just say, hey, we're going to put you up in the top of the line. You actually need to get the vaccine out. Is where our counties are going to start struggling. I think anything else to say on this before we move on. I am not sure actually how many of you here are from California. I think a lot of states will be following a similar model. California is creating a new online system, and it hasn't been deployed yet. It will be. You can go to that and register, and what they're saying is they'll let you know when you're eligible based on the information that you put in that system. If you are eligible, in all likelihood, they're going to direct you to your primary healthcare provider. So, Kaiser, Sutter, College of Medical Foundation, Stanford Healthcare, some of these others, they will be where you go for your vaccines. And they will be notifying you directly as well, or you can reach out to them. Very much, how Kaiser lets you know when you need a flu vaccine. My understanding is they'll do something very similar. It's also likely that some of the large pharmacy chains, the Walgreens, the CVS's, Costco, Walmart, places like that, will be also offering vaccination clinics. Again, you need to be eligible, and you need to be able to prove your eligibility. And then there'll be the option of these large vaccination events, like Petco or Levi Stadium or who knows where. These will be for people maybe who don't have designated healthcare providers or in the public system. We will need to get appointments to go there. Clearly, California is trying to prevent the train wreck we saw in parts of Florida, where you've got elders sitting in lawn chairs for hours or idling in their cars. Really trying to make it a little more organized. We'll just see, right? We'll see. So if you're not eligible, if you're told you're not eligible, like then what, right? You just have to wait. And this new system will let you register for an email or a text. And again, then they'll let you know. If you're a healthcare worker, you're probably wondering, hey, I'm still waiting for mine. I'm in phase 1A. Am I going to lose my space in line? Or are these other people going to get ahead of me in line? And the answer is no. You are still at the top of the line. You're still eligible to receive the vaccine. And hopefully the healthcare institution or the county has already notified that. And then, of course, the ultimate question is, do we have enough vaccines, which that gets to here to serve all these folks? The answer is clearly no, which is why even if you're eligible, that you may not be able to get an appointment or it'll be phased in. We will see how that works, so stay tuned. Yeah, I hinted at this. What about the rest of us? These are really good stories, right? For journalists. So where are the teachers and the essential workers? What about the people with medical conditions? Where are they? This is where you want to ask your county and the state. When are these groups going to roll out? How do you verify you've got a medical condition that puts you at elevated risk of contracting COVID? The feds in the state so far have been referring back to the CDC list of folks with pre-existing conditions, which is on their website. There are probably 10 or 12 of them. I think diabetes 2 is on the list. Diabetes 1 is not. Pretty interesting. And how do you prove that, right? I mean, it's not like you want to send your medical record into the county. So TBD, to be decided. These are the questions readers are wondering and the things we want to start asking. And then again, where will these inoculations occur? I just addressed that a little bit. Some of them are going to be at workplaces. Like I know, Amazon says it's good to go to start inoculating its employees. Clearly, doctors' offices, pharmacies, again, your Kaisers and your Stanford Healthcare. The whole system of the state of how do you find who hasn't been vaccinated? right? Because if we're aiming for, let's say, 80% for herd immunity, you want to know who's getting it, and you also want to know who isn't getting it, and how do we reach them? That's that's tricky. It's really, really tricky. And again, how do you follow up, right? So if somebody gets one dose and it's time for their second dose, you need to be able to reach them, remind them to come in. It makes it a little bit trickier if Pfizer and Moderna have different days that you need your second dose. The logistics of this, not a walk in the park. Again, when will I get it? How will I get it? This is the phases. I want to make sure we've got enough time here. Again, each state has its own system. This is North Dakota or South Dakota's. What's really remarkable in South Dakota is they got all there are 3 major healthcare plans. There are 5, but there are 3 that are major, and they just divvied up the state. And they said, if you've got a contract with us in the state, these are your counties, and you vaccinate everybody in your county. We don't care if you don't have. You're not vaccinating just your members. You're vaccinating everybody. It worked really well. Worked really, really well. They've got their established courier systems. They've got their counties. South Dakota is doing really well. This is their website, which puts California to shame. They've got a nice little timeline. This has been updated since I did it. But like, how beautiful is that? This is another county, I forget which. Look how beautiful this is. We're going to start vaccinating Group D on January 18th. Like, how helpful is that for journalists and for members of the public? County of Santa Clara, that's our county, Silicon Valley. They just now posted, or yesterday posted, where you go to get your eligibility information. And then again, as journalists, we want to make sure it's being administered equitably, right? So a great story is what's your state or county doing to make sure everyone has access. Look at this. This is North Carolina. Check this out. California is not doing this. They're keeping track of who's getting vaccines by race, by age, by gender, and ethnicity. Why all the white folks, you might ask? The reason why is they're disproportionately represented in healthcare workers. These numbers will change. How will this fix this economy? Wow, what a big topic. I'm going to go over this really quickly because I'm short on time. Herd immunity, vaccine resistors, and then immunity passports. How good is good enough, right? So look at what herd immunity is for Ebola, for measles, for mumps, and for the flu. Fauci was saying early on he'd be happy with like 50, 60%. He's now saying 80 to 85%. No one quite knows why. That's what he told the New York Times on December 28th. So boy, if we've got a high level of resistors or people who just want to kind of sit out the first round or two, we're not going to hit that 80 or 85%. And there are a whole lot of people who are worried about that. That's where our role as journalists, talking about why vaccines matter. Great. People worried about safety and adverse events, totally legitimate concern. Vaccines don't save lives, vaccinations do. So we need to be really transparent about that. This is where you go to get data. It's updated essentially every day, called the Virus Network. What we're seeing are maybe tenfold the number of side effects, adverse events that we do with flu, but certainly compared to the 500 deaths that we saw yesterday in California alone, no big deal. The whole issue of immunity passports, great subject cover as a journalist. It's actually beginning to get traction. And why is it beginning to get traction? And that is, if there are parts of the economy that are completely protected, it's considered unduly burdensome is the term that's used. If you're not posing a risk to the rest of the community, there's a really strong case to be made that you can go back to work and you can help get this economy going. It's a really interesting issue that sort of crosses political lines. Clearly, conservatives are super interested in getting business back up and running. But liberals, this has a very leveling effect, right? So if you've vaccinated your essential workers and the bus drivers and they want to go back to work, super strong argument to be made that we need to get them back. If we have people who don't want to get vaccinated, fine. But the rest of us, there's a strong case to be made that we can go back and get our economy going, get our schools going, get life back on track. All right, questions. See how we're doing on time here. Michelle, I'm happy to answer questions in the chat. Maybe some of you can exchange some of your own answers.
Yeah, thank you so much. So we have a bunch of questions right now. Please do put your questions in the Q&A panel. That's where we're looking for questions, not in the chat. And I want to just thank Lisa for this really tremendous overview that's so grounding. We have a bunch of questions, Lisa.
So before I move on, while people have chance, they can keep submitting questions. Just before I forget, who to follow on Twitter. I didn't know where to stick this, but and these are names these are household names to a lot of you. Lipsitch Walker's fabulous. These are all, you all know these folks. We're happy to share the slides.
And all these slides and the webinar video will be on our website. So if you miss something, you can go back to it.
There you go. Great. Okay, sorry. Let me unshare screen maybe, huh? Stop share?
No, yeah, sure. That sounds great.
Okay. I'm going to try and answer to the best I can. I'm going to do the best I can. And
yeah,
I'm happy to follow up, actually. And if you've got my email, I think lkrieger@bayareanewsgroup.com.
So Lisa, we have a bunch of questions that I kind of grouped together about tracking how vaccinations are going in different jurisdictions. So I'm going to just kind of go through, there are like around 4 of them, just because I feel like you can maybe answer them all in one go. So for example, here we go. Audrey Dutton says, what is the lag time on dose administration data? Idaho's system allows up to 72 hours to enter vaccine records. So we have up to a 3-day lag. So we're trying to figure out if we're truly slower than other states and what are the lag times in other states. Meantime, Monia D asks, vaccine dose administration numbers are coming from sites at the end of day or based on shipment counts. Benjamin Hardy says, and this is pretty interesting, I'm in Arkansas and the CDC vaccine tracker shows we're near the bottom of the list for percentage of shots administered. When a reporter recently asked our Secretary of Health about this, he said the CDC tracking data for Arkansas was simply inaccurate. The health secretary, Dr. Jose Romero, is the chair of the CDC's advisory committee.
You're right, he chairs that ACIP.
So he probably would know, have you heard about this in other states? And is the CDC data fatally flawed? So they're all kind of different ways of coming at the same question. And I thought I would just group them for you.
The timing and the reliability of data. I don't have any good answers. I know California data tends to be slow. I remember with our cases and our deaths, it was slow. Ship it to the CDC and then the CDC needs to input it. But clearly whatever data you get locally is going to be more accurate and a whole lot faster. Not a good answer. I think 3 days, to be honest with you, is probably about on par. And I know certainly with our cases, we'd ship things to the CDC and they wouldn't reflect for a couple days.
So you would advise people to rely on the state version of the data over the CDC version.
Yep. When you think about it, the county, somebody sitting in a county office, let's say the healthcare systems are reporting, because this is all just so downstream, right? So the healthcare systems are reporting back to the county is reporting to the state, and the state's reporting to the CDC. So CDC is always going to be a little bit late and a dollar short. So yeah, local is better.
Yeah, and then there's a few other data questions here.
Forgive me, of course, the long-term care facility data, because that will be federal. Go ahead, Michelle, I'm sorry.
Oh, sure.
Yeah.
So the long-term care go to the federal site, not, okay.
Yes.
Is there a place to download historical vaccine data to see the changes over the last few days somewhere on the CDC site or elsewhere?
Not that I've seen. Great question. They typically update it and then it's gone.
Okay.
Yeah.
and
Yeah,
maybe we'll find.
our data person for a while was getting screenshots and saving them. I don't think for vaccines, but I know she was for cases because it's really hard to watch trends over time, right? But
Yeah. And this is somebody who says that they've written some vaccine stories for a publication, small publication that focuses on Black, Indigenous, and people of color audiences, and that there's changes from day to day in national and state plans that make the stories almost inaccurate as soon as editors start reading them.
I know.
Strategy can non-daily publications use to write helpfully for audiences about something in flux?
It's nearly impossible, and boy, do I share your pain. And we've got early deadlines too, and things. Just the other day, and like, who the hell knows? Your governor gets up and gives a press conference, right? And you're like completely surprised. And not only that, often the governor or your director of health will it'll be very general, right? And often the counties are surprised at the same time, and then you're having to update. So to be honest with you, I would stay as general as you can, because at least that you're not wrong. And I think there's a lot to be said about general stories and deeper stories that are more analytic, because you'll see in a lot of the daily breaking stories about administration rates and all that, we're not able to get into the analysis. So you have advantage that a lot of us don't, and that you can do a deeper dive and just see that as where there's value added. Trying to stay on top is super hard. And then of course, now with WordPress that we're writing on, you're just going in and updating all the time. Like our morning story posted online is a fundamentally different story than when we sent to print the night before. So people are reading things in the morning paper that's already different than what you get on your website. Yeah.
Lisa, would you recommend maybe just putting in a time reference, like as of mid-January?
Yeah, there you go. Thank you.
So,
yep.
Yep. We have a question from Lynn Bonner that I think could be maybe more general, help people more generally elsewhere. So she asks, long-term care facilities in North Carolina are using a small fraction of the doses they've gotten. Is that a problem with CVS and Walgreens? Is it vaccine hesitancy or both? And to me, the bigger question is, how do you track down in your state, what is the problem, and sift between the pronouncements and the data?
Right,
is there
right.
methodology?
Good luck getting CVS and Walgreens to tell you. I would, if you can, obviously go to the facilities themselves, because I guarantee you that the kids of the parents who are there are super frustrated, and they want to know. They're asking the same question. And you can play devil's advocate. You can say, we understand other states or other facilities have been more successful in getting more vaccines into arms. Help us understand what the problem is. Like, help us tell your story. Do you need more resources? Are CVS and Walgreens not showing up? Do they not have what they need? Like help us make your case for you and tell us what the problem is. Your second point of, is it an issue with vaccine resistors, is a great one. We're trying to find out what % of people are resisting, because and they know, right? They know every time someone opts out, they're writing it down someplace. And we're trying to find out what % of healthcare workers are opting out and why. We have heard from counties, and there's a wonderful group called Association of Counties or something like that. A woman there, Bryant, last name is Bryant, who talks to the counties all the time. She says she's hearing from some counties that they have 500 doses and they've only dispensed 3 because nobody wants them. And the counties want the flexibility to offer it to other counties. Right now, they don't have that flexibility. Anyway, I'm getting off point, but the whole, like, we as journalists, we need to know how many people are opting out, because that's core to the success of this whole program, right? And it also tells us that there's a communication problem and a messaging problem. And then the stories we need to be writing is, this is what happens if everybody opts out. You know, you want your economy to stay on ice indefinitely. That's what we're talking about. So anyway, it's and also, what reasons are they opting out? Why are they opting out? A lot of it has to do with how you present the choices. Are there ways we can address people's concerns? A really rich um, area for journalism.
We have a question from Kate Santich who wonders, do you know if the federal pipelines to state versus long-term care, et cetera, essentially have to compete with each other for the limited vaccine supplies?
No, great question. Thank you. That was one of our first questions when they unrolled this. The pipeline to long-term care facilities is completely independent of the state supply. Of course, now if you're like West Virginia and I think LA, maybe if you opt out of the federal program, then they are getting their doses from the state supplies. So ask them, but we were told quite definitively that the pipeline from CVS and Walgreens is coming from a whole different inventory from the feds and state.
We have a question from Tiffany Stecker who says, what do you think are the most interesting angles for reporting on the social justice equity issues with the vaccine rollout?
Oh, great question. Thank you. So I think the whole issue of, and this is California, so you think about who some of these essential workers are. They're the people who have historically have least access to healthcare, right? Like in California and probably North Carolina too, we have food production line workers and we have people out in the fields that don't have Kaiser. They don't have a contract. They don't have a regular primary care provider. So it's a great story idea. And we were trying to figure out how do you reach these people, right? So maybe the United Farm Workers, maybe the unions that represented the food workers, the people that help public clinics that help with food and ag workers. So for us, the question is, people who are historically have least access to healthcare and are at greatest risk of COVID, they need to be getting these vaccines. So I think it's a great story if you can do that. And then clearly others of people providing, daycare, all these unlicensed daycare providers, these wonderful older women with 8 or 10 kids, often Latino in California, in their homes, but no state license. Who's reaching them? Who's going out to them? So really great story. And frankly, this pandemic's not going to be over until we reach those folks. And those ICUs, we're not going to start easing that burden until we reach those folks. And I get so mad when you hear about, athletes or other celebrities or whatever getting their doses, their vaccines. That's not solving our problem. Those aren't the folks who are at risk, and those aren't the folks that are filling up these ICUs. And until we get those ICU levels down, we're all stuck at home, right? And our kids aren't going to school. So anyway, yeah.
And you mentioned something along these lines, Lisa, when we were talking earlier, also about when we're talking about these broad categories of essential workers, how does a jurisdiction distinguish between, say, a farm boss who's at his desk and a farm worker? I don't know if you wanted to elaborate on that idea too.
Excellent question. Thank you so much for bringing it up. So who are these people and how do we define who they are? So California put them in these very separate categories, but they're by sector, right? It's like the transportation sector, AC transit, buses, critical manufacturing, and then they define that. So what about so this is a question to ask your state or to ask your county, how do you verify who someone is? And then is there going to be some poor person at a desk sitting there and someone brings in a business card with some obscure title on it as to what they do? Like, how do they decide whether this person qualifies or not? So hopefully this state platform that they're rolling out will at least go through a lot of that. And for those of you in other states, hopefully you will also have a state platform that'll start to, so that someone can put in their job. We haven't seen this platform yet. Hopefully there'll be like, a drop-down menu of where you identify what sector you're in, and then they'll make that decision for you. Because otherwise it's going to fall to the poor person at some like table who's been sitting there for 4 hours looking at business cards trying to decide, which I think is frankly what's happened in Florida and Texas and a few other states.
So we're kind of running out of time. I'm just going to quickly ask.
Any other questions, Michelle? How
I'm
are we
sorry.
doing on time? Yeah.
Yeah, we're kind of running out of time. I'm going to quickly ask maybe one, or if there's time, two more. And then what I'm going to suggest is, because we probably have an additional 15 questions, Lisa, depending on your time, maybe next week or whatever, we can ship some of those to you, or we can pluck out a few of those that we can maybe then put your responses on our website, because we're not going to get through all of these. But one of them is there any restrictions? This is from Diana Jurado. Any restrictions for people whose migratory status is not clear? I have a lot of families asking me that question in my office.
I'm sorry, restrictions?
Any restrictions on getting a vaccine for people who are undocumented?
Oh, for undocumented? No, not in California. My understanding, they can go to a public health clinic. That's a great point. I think people need to know that they don't have to bring, birth certificate or, proof of residency or anything like that. At least in California, absolutely do not. And that's a huge fear, obviously, and the fear that we're not going to reach these folks if we scare them away. My understanding is that, and we'll see, but at the clinics, they will not require that.
And then we'll make the final question one from Jamie Baxley, who says, the first dose has been administered at several long-term care facilities in my county, but some nursing homes and assisted living communities here are still waiting for their turn. Our health department doesn't know how facilities are being prioritized by the federal government. How can I get this information?
So the state, so this is the long-term care facilities. That's a very good question. I think you probably have to go to the feds, because the state has literally no authority in that at all, which is why some counties have broken away and are doing it themselves, like LA and some of the states. It would have to come from the feds. I've actually heard a very similar complaint that there are some assisted living facilities. One has to presume that the skilled nursing facilities and facilities with higher levels of acuity and vulnerability are first on the list, one would hope. Clearly, there are assisted living communities and continuing care facilities where folks are out on the tennis courts, even though they're in their 80s. But yeah, really good question, and that's got to come from the feds. Good luck with that. They don't answer phones. They only respond to emails, and they kind of send emails when they want to send emails. They're trying really hard. Any of you out there from Colorado, I get answers from your state health department in like 30 minutes. California takes 24 to 48 hours sometimes. Anyway, it varies a lot. Responsiveness varies a lot.
Well, I want to thank you, Lisa. This has been a tremendous overview. We are so grateful, and I know all of the listeners and viewers of this webinar as well. The webinar video recording will be on our website, centerforhealthjournalism.org, a little later today, along with Lisa's slides. And we'll be sending all of you a quick survey asking you your thoughts on this webinar and your ideas for other ones. So please take a moment to fill it out. And should you want to support this webinar series, you can just send a text to 41444, type CHJ, and look for more instructions, and we would greatly appreciate that. Have a wonderful day and good luck with your reporting.